Hello, I'm Dr. Bill Hopkinson from the Department of Orthopedic Surgery and Rehabilitation. The purpose of today's video is to demonstrate the normal lower extremity examination. We'll discuss the inspection of the lower extremity, looking at the bony landmarks, looking at the surface anatomy, palpation of the joints, and verification and examination of joint range of motion. I think it's important to demonstrate that before you do any examination, you should wash your hands properly before the beginning, and to always be concerned about the patient's modesty and appearance. I'd like to introduce Sal, who's our patient standardized model, who's going to help us with the examination. I think it's important when the patient first comes in, you observe their gait and watch their overall ability to walk to get an idea of what's going on. Hello, Sal. How are you today? How are you doing? If you would mind walking back and forth for me. Sal, if you mind sitting up here. And go ahead and take your socks off. Observation of removing the patient's shoes and socks gives you an additional idea about their functional range of motion and their ability to move. With the lower extremity examinations, you want to look at their nails, their skin fold, looking for any ulcerations or discolorations or vascular injuries. You're looking for scars from prior surgery, and you're evaluating overall alignment of the joints. You're looking for any involuntary motions of the lower extremities, such as muscle fasciculations or a tremor, and any soft tissue swelling. You're also going to palpate the pulses, the dorsalis pedis, the posterior tibial pulses, looking additionally again for any redness, bony enlargements, abnormality, or any signs consistent with diabetes or vascular disease. And also, when you first look at the patient and you look at their overall alignment, it's important to see if they have varus or valgus malalignment, such as you would see in knock knees, which would be valgus, or bow legs, which is varus. It's very common for this vascular disease or diabetes to see ulcerations or lacerations over the malleoli, so I think the bony prominences of the ankle and the heel are very important to look at for any of those things. Now, Sal, if I won't mind having you lay back on your back. As I mentioned before, you want to be very, very careful in preserving the patient's dignity and to make sure the examination is done with great concern about their privacy. For the orthopedic examination and the examination of the lower extremities, I usually use a gown or a sheet to make the patient drape off the lower extremity so that I can free up the extremity and examine it without making them uncomfortable in this part of the examination. We'll start looking at the bony prominences, and we'll start looking at the hip joint. The anterior superior iliac spine is a marker on the pelvis. Then you're going to look and feel the greater trochanter, which is on the lateral aspect of the upper femur. Sometimes it helps to have the patient flex and rotate, and you can feel the prominence over the greater trochanter, looking for any swelling or pain. Going down the leg, you're going to look at the overall alignment of the femur. You get down to the knee joint, looking at the medial and lateral femoral condyles, which make up the knee, the patella joint, the extension mechanism, which consists of the patellar ligament or the patellar tendon, and the quadriceps mechanism, which goes into the patella. Also, you can feel the tibial plateaus, both the medial tibial and the lateral tibial plateau. Using your thumb, you can palpate the ridge of the plateaus, and it's much easier to do this in flexion. Also, you can feel the head of the fibula on the lateral aspect of the knee, which is a bony prominence here. Going further down the leg, again, you can look at the medial and the lateral malleoli, palpating that. The medial malleoli is anterior to the lateral malleoli, and then the forefoot and the midfoot. Now we'll go over the range of motion of the joints. Looking at the hip joint, it's important to assess flexion and extension.